Thank you, Noah. Hi, I'm Eva Danesh, also working with Noah, Dr. Schwartz, and Dr. West at Total Lipedema Care. I have nothing to disclose, and today I look forward to speaking about some of our most recent findings with our newest patient-reported research study. So the objective of our study was to analyze the lipedema reduction surgery alongside our manual lipedema extraction technique. So Dr. West will be talking about this technique in a few moments. And our survey also wanted to look at more of lipedema's associations and just so we could learn more about the condition. We asked our participants over 140 questions. They ranged from their history with lipedema all the way to their experiences before and after surgery. Our survey was reviewed by an internal review board, and it was distributed online via Vanderbilt University software called REDCap. We had 62 participants in our study, an average age of 49 years and an average BMI of 42.8. Each participant had at least one surgery with us using the manual lipedema extraction technique, and 17% had prior lipedema reduction surgeries without using that technique, and 30% were completed with their course of surgeries. So to start off with some demographic information, we know that lipedema is strongly associated with the estrogen hormone, and we see that here reflected with 92% of our participants reporting that at least one of these hormonal events, they noticed a severe increase or worsening in their lipedema symptoms, the most being at puberty. We also know that lipedema runs in families, and we see that reflected here with 82% of our participants noting that a female family member, so a mother, a sister, an aunt, or grandmother was similarly affected by lipedema or had a body type that was similar to their own. We know that lipedema is a connective tissue condition. We see that a quarter of our participants also have Ehlers-Danlos syndrome, another connective tissue disorder. A lot of our patients also say that they are more flexible than a typical person. Anecdotally, we hear from a lot of them that when they were younger, they were some of the most flexible and most athletic people in their age group. However, after puberty, once they started developing symptoms of lipedema, they unfortunately couldn't engage in their usual activities the same way. We also saw that many of our participants experienced joint issues, with the most being in the knees. Almost 50% of our patients said that they were also diagnosed with lymphedema, and 13% said they were also diagnosed with Derkim's disease in addition to their lipedema. However, we do believe that these numbers are slightly inflated due to, as we all know, unfortunately, the lack of awareness about lipedema. So moving on to the impacts of the lipedema reduction surgery alongside the manual lipedema extraction technique. So I want to start off with this quote from one of our research participants. She said, "I was almost entirely immobilized before surgery. Having lipedema is like being held prisoner in your own body." That sentiment was reflected by almost all of our participants. 92% of our participants said that before surgery, they had functional impairment, so mobility issues often resulting from the inflammation, the pain, and the heaviness of legs. And unfortunately, a third of those participants also indicated needing to use assistive devices like wheelchairs, walkers, and canes. However, following surgery, of those 92% that said that they had functional impairment, 93% experienced better movement. Unfortunately, pain is another thing that so many people with lipedema struggle with on a daily basis. So when we use that 10-point standardized pain scale to ask our participants what their daily pain level was like, the average was a 7.1. So 7.1 represents severe pain on that scale on a daily basis. However, after lipedema reduction surgery in the areas that were operated on, that average pain level on a daily basis went down to a 1.8, and 1.8 represents mild pain on a daily level. And that's a 74% decrease in pain. The most decrease we saw was in the buttock shelf, with an 81% decrease in daily average pain. Heaviness of legs is unfortunately another thing that so many people with lipedema go through, and we did notice that a majority of our participants noted lighter legs following the surgery. And for this last segment, I want to briefly introduce a few patients who underwent lipedema reduction surgery without MLE and then came and with Dr. Schwartz and Dr. West had manual lipedema extraction in addition to their regular surgery. So this first patient noted that with the previous surgery in the first few days, she was having trouble walking, was disoriented, and was in lots of pain. However, following the MLE surgery, with Schwartz rapid recuperation that Noah was telling us about earlier, she was able to walk the day of. This next patient, after that non-MLE surgery, she said that she was left with nodules in her leg that were still visible and she could feel under her skin. However, after the MLE surgery, she not only had much less bruising and less pain, but 30 days after, she felt less volume, she felt more feeling and less sensitivity. And finally, with this third patient, provided us with a lot of great information, but just one thing to highlight is 6 months after the non-MLE surgery, she could still feel beads under her skin, still feel those nodules. However, following her MLE surgery, her skin was looser and she felt like a little bit more of that lipedema was removed. So patients are now able to walk longer distances, they're able to hike and engage in more activities, they're able to play with their children and grandchildren and not be scared that they're going to hug them and they'll get bruised or feel pain. And they're also able to sit comfortably where they choose, when they want to choose, and essentially they're able to get their lives back. And I want to conclude on this quote from one of our participants who underwent surgery with us, who said that the surgery for her was life-changing and that she's genuinely happy now. She doesn't have to worry about, will I fit here? Will I need to rest? Will I be able to stand back up? And she can just live. So thank you all. Our research email is right here, so please reach out if you're interested in seeking more information or would like to participate in some of our studies. So thank you.
Thank you. Wonderful presentation. Patient-reported outcomes are fabulous. That's exactly why we do it, is to reduce pain and have people have improved quality of life and increased mobility. Are you considering doing any objective testing to look for strength, mobility, and stamina improvements in these patients?
Yeah, so we look forward at Total Lipedema Care. We try to be a really academic institution. We try to really study our outcomes, and once we're done with this, which we are just doing by survey, we're hoping to look into more ways that we can actually involve ourselves more in the patient's day-to-day life, see what their struggles are in the beginning and how our surgeries can help improve their outcomes in the long run, and make sure that it is really in the longest run that we can make it.
All right, thank you.
Thank you.